Good day, I'm Dr. Andrew Lewis, University of the Western Cape. I'm going to present a talk on ADHD for the module ESP 242, Psychological Intervention in Education. So the question is, what is ADHD? It stands for Attention Deficit Hyperactivity Disorder, and it describes children who display persistent age-inappropriate symptoms of inattention, hyperactivity and impulsivity that are sufficient to cause impairment in major life activities. And that's the three major aspects of ADHD: the inattention, the hyperactivity and the impulsivity. And those three aspects are of importance for us when intervening and addressing ADHD. Secondly, it's a neurodevelopmental disorder which has to do with the brain and development, and also generally starts at childhood, present in more than one setting. And all these aspects are important because in order for us to diagnose and intervene, we have to understand what ADHD is. So what causes it? As I mentioned just before, it's neurodevelopmental, so that has a neurological basis to it. Sometimes there's a need for certain chemicals within the brain which cause a lack of planning, and this impacts on the child. Can also be genetic in that it's carried from one parent to the child or from one family member to another. But what also causes inattention, for example, is psychological reasons. If a child is perhaps anxious or emotionally distressed, family systems as well can give rise to inattention. Certain behaviors are modeled, and this causes certain children to not concentrate, but also to display impulsivity and hyperactivity as well. The environment can also impact on children. For example, if it's a noisy environment and which causes some children to display inappropriate behavior, then they cannot pay attention. Educational reasons as well, certain challenges that children display, for example, if they have learning challenges, dyslexia, for example, which can cause them to display inattention, not pay attention in class and not concentrate in class as well. As I mentioned, emotional challenges can also give rise to inattention, and even children being hyperactive. If a child has been through a trauma, this can cause them to not pay attention, but also to be hypervigilant and startled. For example, if a door has to shut closed quickly and noisily, this can give rise to a startled reaction. As I mentioned as well, learning challenges also can give rise to inattention. Not being able to concentrate on the board or not being able to read can give these inattentive symptoms. Allergies and diet are also been known to contribute towards inattention. Children drinking fizzy drinks can also come back after break displaying heightened activity. The caffeine in certain foodstuffs and drinks can invariably cause them to not pay attention, be hyper, and basically jumping up and down in class. Visual perceptual and auditory perceptual challenges. If a child cannot see on the board, then they will not pay attention. If they cannot hear, or if they interpret what they've heard differently to what is being said, then that can be perceived as being inattentive, and they won't pay attention and won't concentrate either. So as a psychologist, what we normally do is we diagnose ADHD. We make use of a statistical manual called the Diagnostical Statistical Manual, the 5th edition, and there's several symptoms that we make use of when we diagnose ADHD. And it has to do with within certain settings and within one or more settings as well that we diagnose. So for example, if a child only displays inattention in one setting and not in others, then we have to explore that further, because in order to be diagnosed with ADHD, it has to be, for example, in the school setting and in the home setting as well, where several symptoms are displayed. And you can see all of those symptoms on your slides when you receive them. So what's the prevalence of ADHD? In other words, how often does it occur? And so the prevalence is amongst most cultures that it prevails, and they say 5% of children and 2.5% of adults, which means that 5 out of 100 children will display symptoms of ADHD, and it goes right through to adulthood as well, where 2.5 out of 100 adults will display ADHD symptoms. So it is quite prevalent, and it is prevalent in school settings as well, and hence the need for intervention. What we also pick up with ADHD is that it goes along with several other disorders as well. So often what we see is inattention together with another disorder, for example, anxiety, even depression, oppositional defiance, where children oppose and defy, conduct disorder, where they can become very destructive, also depression, as I mentioned, anxiety, but also specific learning disabilities as well. ADHD coexists with other learning disabilities. And this is part of the challenge as well, that often what presents itself as ADHD can be another disorder. But whereas another disorder, such as a learning disorder, such as dyslexia, is presented, then it can coexist with ADHD as well. So often within a school setting, a child with a specific learning disorder like dyslexia can also have ADHD as well, or anxiety. And there's several other disorders that it coexists with. And it's important that these are addressed holistically, in other words, the whole person, but also systemically as well. So how can we intervene, and how can we support children with ADHD? First off, you as a teacher, it's important for you to observe the behavior of children who give these symptoms or present with these symptoms. If a child is constantly inattentive, cannot concentrate, distracted by stimuli, outside noises. This constantly occurs, and it impacts on the child's behavior and learning abilities, but also on the other children as well. Then it's necessary for you to observe and just take good notes as well, and to discuss very delicately with the parents as well your observations. As I said, what sometimes presents as inattention can also be due to other factors as well. It can be due to the eating habits of children. It can be emotional challenges as well. So before a diagnosis of ADHD is made, which takes a while and goes through several people before a diagnosis like ADHD is arrived at, it's necessary for your valued input as a teacher. So your input will contribute to an educational psychologist's assessment. We as educational psychologists do a thorough assessment where we do several tests within the test battery, observing behavior while the child is being tested. And only then, if we suspect that the child does present with inattention and hyperactivity that are beyond the norm and impact negatively on the child, then we will refer to either a child psychiatrist or a pediatrician, just to get a good indication of if this is ADHD where medication is needed, or is it due to other factors. What's also necessary thereafter, if the child does receive medication, is for additional support. And here, learning support can also be very helpful. Learning support teachers, but also an occupational therapist as well, can also give valued input in teaching skills for these children on how to concentrate. We call these skills metacognitive skills. In other words, thinking about thinking. How do I concentrate? What is it needed to concentrate? What are the steps that I need to take in order to concentrate? And that's where you as a teacher can also support these children on just bringing their attention back when needed. If they are a bit hyper and fidgety, how to intervene, what constructive ways you can devise to support this child, because every child is unique and they have unique challenges as well. So, like I said, first off, I look at the criteria as an educational psychologist, those diagnostical statistical manual criteria, and only then do I refer to a psychiatrist or a pediatrician. Once a child has been assessed by one of these medical practitioners, and if they do receive medication, then I will support with certain strategies. I make use of the circle of courage, which you've been exposed to, and I adopt and adapt that circle of courage for every single child that I will see. So, as you know, circle of courage consists of 4 quadrants: belonging, independence, generosity, and mastery. So how can the child with inattention master certain skills in order to concentrate? What needs to be mastered? And this I will discuss and practice with the child as well. I want them to feel that they belong in the classroom as well, that they're not different. And that's where sensitively you as a teacher can also develop their self-esteem and allow them to feel that they are part of the group and not different. And that's why it's important not to label children with these challenges. Children who do have ADHD, they can develop into very effective entrepreneurs. They have brilliant creative skills, but once they've mastered certain challenges, they function normally and contribute greatly to society as well. Because at the end of the day, we want them to be independent adults, and that is one of the quadrants of the circle of courage. So letting them feel that they belong, being generous to them, allowing them to strive towards independence and mastering certain skills. So some further examples, what I do with generosity is boost their confidence, allow them to experience success. Just that sense of feeling that they can belong and that they are accepted in the classroom. The mastering of certain metacognitive skills, and also just developing that sense of responsibility and independence within them, that they feel that they can achieve and that they are tapping into their strengths and successes as opposed to their challenges and deficits. I've given you some strategies that you can apply in your classroom. I've also given some strategies for parents, how they can support children with inattention and hyperactivity as well as impulsivity. And what I'd like you to do as your task is to take the circle of courage and just develop the 4 quadrants in a diagram, and I would like you to just develop several strategies that you as a teacher would like to inculcate and develop in a child with inattention, hyperactivity and impulsivity challenges by making use of the circle of courage. I'd like you to think about those strategies, and I'd like you to take them with you one day when you do teach, because you will have children in your class who have inattention challenges, hyperactivity, and I'd like you to be prepared and just to understand how to support them positively and to tap into their assets and strengths as well. Thank you very much.